think education is a critical component of being a physician, and we are always educating regardless of if you are working in an academic center or in private practice in the community. So prior to coming to UVA, I worked at a community emergency department in Richmond, and I was educating all the time, just as much as I'm educating here. That could be patient when you're talking with them about their diagnosis and how to manage it. It could be with nursing and other colleagues who are working there. But education is a critical aspect of our profession, and so I think it's important that it's recognized.
I think Dr. Easter, the way he leads, the way he guides this residency program is one that is defined by kindness, and I think all the residents know that they have, or he has their back, and that he's always working towards their betterment. So even in the tough times, when things are not always the rosiest as things are in the medical world, they know that they always have someone who will fight for them, that they can rely on, and they can just inherently trust to have their best interests.
So I'm excited when my learners will come to me and be like, I wish you'd do this a little bit differently. Maybe don't stand so close to me when I'm doing that procedure. It makes me a little bit nervous. I appreciate you stand further back. Or some learners might say, I'd rather you stand right next to me when I'm doing this because I'm a little bit nervous about how I'm doing it. And so getting that feedback is definitely bi-directional, and I think that certainly requires trust for them to know that we're comfortable getting that feedback as well.
He's the reason I became an emergency medicine physician. He's the reason I came to UVA. I had my own kind of crisis as I was transitioning from a junior resident to a senior resident about what I was going to do with my career. He is the one who guided me to a fellowship in residency leadership and residency education, and continues to guide me on kind of the next steps in my career and how I hope to spend the next multiple decades of my life.
From my experience within residency, some of my mentors, the things that they taught me, I still hear their voices in my head when I'm taking care of my patients. And so there's no more gratifying moment than when a resident writes you or sends you a text and says, hey, I heard your voice in my head when I was taking care of this patient, and I went and I did this because I remember you talking to me about that when we were working together. And that's just immensely rewarding experience to have.